Yes, hi, good afternoon everyone, and thank you for joining today's webinar, which is on the coronavirus regulation and the ASQA sector. We've had a lot of questions being raised on this item around regulatory conditions over recent weeks, and I'd like to really thank the support from both TEQSA, the Tertiary Education Quality and Standards Agency, and ASQA, our Australian Skills Quality Authority, for their support in making time available to answer some of the questions that we've been receiving. We're very conscious that this is a really difficult time for many providers and indeed the students that are impacted and staff. But we want to assure you that from English Australia, we're committed to providing whatever level of support is possible. Just as by way of introduction, I'm Brett Blacker. I'm the CEO of English Australia. Today, I will be moderating the session using some of the questions that you've sent through to us in advance of the webinar today. But also, we do encourage you, if you've got questions that are raised throughout the session, please send them, and we'll try and pick up some of those at the end if it's not covered in terms of the responses that you receive. We received a really high number of questions, and I think that's a testament to the, I guess, scale of concern and inquiries that people have on how to respond to the present situation. In the interest of time, what we've done is try to collate those questions under some specific themes. We've looked at majority of questions coming in around course progression and how do people treat course progression, certainly in terms of course delivery, and that course delivery ranges a whole lot of issues from online, blended learning, as well as, you know, in the event of school closures, and then ultimately around health and safety as well. And as I mentioned, we'll try and cover off some additional questions at the end of the webinar. I do like to note that we received questions that weren't necessarily specific to today's webinar. Some questions around student visas and the treatment of student visas. We won't be responding to those today, but we're happy to follow up with those individuals and through other committees and forums where we can answer those questions. There are also a number of questions that were more pertinent to the Department of Health, and given the way in which the circumstances around the virus are evolving, certainly decisions on a state level from various health departments are going to be critical in terms of the way in which providers respond. So where there's been overlap, we've included the question, but if it's specific to those that are relevant to Department of Health, we won't be able to cover that today. So I'd just like to introduce our two panelists. We're going to have representatives with us today from both ASQA. We've got Ben Granola, who's going to be representing ASQA as part of this presentation, and we've got Chris Vega, who's going to be representing TEQSA as part of the presentation as well. But again, thank you to their support. I know we have ongoing liaison, and certainly if there's things that we can't respond to directly today, we'll take it up on your behalf as well. But with the interest of time, and we've got a strong number of people already online for the webinar, I think it's best we move straight into introducing our two regulatory agencies. So first, I'd like to invite Ben, who will give an overview, first of all, from ASQA, and then after Ben, we'll have Chris.
No worries, fantastic. Thanks for that, Brett, and good afternoon, everyone. Look, I guess First off, I'd just like to say thanks for the opportunity for being able to participate in the webinar, and hopefully we'll be able to provide you with some information that'll help you going forward. I guess the main thing to be aware of is that this current situation is evolving, and our information updates will probably change from this week to the next week, depending on whether the level and the concerns around the virus change. But I would suggest that to keep informed, please go to our website. We have been providing regular updates in relation to what ASQA considers the best approach to vet training. I'll just sorry, I've just lost control of the slides. There we go. So, like I said, I'd just like to acknowledge that we do understand the challenges facing providers at the moment, and we encourage providers to consider flexible arrangements, particularly for students who have been directly impacted by the travel restrictions or isolation periods. This might include such things as flexible course delivery through online processes, which I know a few people have got in their questions later on, or additional makeup sessions for days that students have missed. Look, going forward, ASQA just really is trying to make sure that if students are affected by this process and by the coronavirus, that there is evidence kept by the providers, so that if issues arise in the future in relation to student attendance, those sorts of things, that the provider has evidence of flexible arrangements that they've put in place for individual students. We also recommend that you contact us if you are affected in any way. That'll allow us to look at what you're proposing and take a note of that as well. Like I said, we've seen already a lot of inquiries come through to our info line, but like I said, if you do have any inquiries at all in relation to the virus and providing students with flexible arrangements, I'd advise you to contact us, and I'll get you to just change the slide there if we could. So if you would give us a call on 1300 701 801, or send us an email at inquiries@asqa.gov.au. Our info line have been dealing with a number of inquiries from various providers, but I guess the main thing from our side of things is we are responsible for regulating quality in the sector. We only have limited ability in relation to the health aspects and can't answer questions in relation to what should be done in relation to isolating individuals affected or anything like that, and we'd defer to the Department of Health and other expert agencies in this space. So look, we will assist where we can in relation to training and assessment, but we'll cover this stuff in the questions later. I guess I'd suggest if you have any questions, please just give us a call. So thank you, Brett.
Yeah, thank you very much, Ben. And we'll now invite Chris from TEQSA just to also do an introduction from their agency.
Good afternoon, everybody. Firstly, I'd like to thank English Australia for putting on this webinar and for inviting its members to get an update from TEQSA as to what our position is and how we would like to involve ourselves and assist providers in dealing with the situation that we're currently found ourselves in. Much like ASQA, we do acknowledge that this is a difficult time for not only for students but also for providers, and as much as possible we are open to communicating with you and providing you as much assistance as we can. Now, as you can see on the screen, we do have the TEQSA website has information about the coronavirus and any latest regulatory advice. That has been, I think initially that was on the 17th of February, it's been updated since, and has also included a section in relation to ALICOS. So as you can appreciate, due to the, I guess the teaching or the delivery method of English language courses, that it may not necessarily be as straightforward as it would be for a higher education course. So we do encourage providers to contact TEQSA if they have any questions in terms of their delivery mode, or I guess the plans to how they would like to approach delivery in, considering the circumstances that we're all at. In terms of, I guess we've also, I mean, just from a higher education perspective, obviously we've made contact with our providers just to ensure that, just to make sure that everything is tracking okay, just to touch in. Obviously, we're very cognizant of the fact that a lot of providers may or have a lot of students who may have been impacted, and therefore this may have financial implications. So we've just, we've made contact with providers, with universities in particular, just to make sure that, things are okay and offer, I guess, our services, if you can put it in that way, to help, I guess, find ways that we can all work together. Also, as Ben had mentioned, so there are updates on the TEQSA website. So if you just regularly check that, we do obtain our information from the Australian Department of Health, and also take directions from the Department of Education, Skills and Employment. And I think in terms of TEQSA's approach to the regulation, as we've mentioned, we really wouldn't be undertaking any regulatory action. However, we would like to see in the way that providers are delivering their courses that it is still quality assured, and that the learning outcomes are still being met, or could still be met for students. Now, I think some of the questions that were sent in will have, kind of asked in terms of how providers can deliver online and stuff like that. So I think I'll go into it in a little bit more detail when we respond to all those questions.
Thank you, Chris. Thank you for both you and Ben and the support in today's webinar in itself. Okay, so we're going to move into the questions now, and again, to everyone that's already put questions in, we are going to try and attempt to go and show those to you. And as I mentioned, if there's things we haven't covered, we are more than happy to follow up on an individual basis for you to make sure you receive the information that you need. So we're now going to go into the first Q&A component, and I'll switch off so we can just go into the questions. And we're going to have a response for most of these questions from each of the regulatory providers. I note that in some instances we're probably going to have information which will be consistent between the regulators and also between where different approaches are required. But I'm sure it'll be useful to have some context. So first of all, in terms of course progression, we're just going to move into the questions on those. So some of the questions that we've received have really been around the attendance requirement, and particularly for students that fall below the 80% requirement. Now, obviously, there were considerations for whether they've returned back. Initially, it's affected by the restrictions in China, and that's due to the break, meant that they've fallen below the 80%. But I guess in terms of this particular question, to both Chris and Ben, attendance and the proportion of study attendance requirement, it's a pretty hot topic, and we certainly appreciate your advice.
I guess from
Okay. Yeah, go, Chris.
Chris, maybe you first.
Yep. So I guess from a TEQSA perspective, I mean, the scenarios that have been provided, so particularly the first one is, you know, a circumstance where a student has come back to Australia and is in self-quarantine. So in terms of monitoring attendance, obviously the expectation is that the provider will already have their policies and procedures in place to monitor a student's attendance and also their progress, and that will continue to be implemented. Now, obviously, the circumstances that we're in is quite extraordinary, and it's, you know, it would, as Ben had mentioned earlier, as long as these are documented, you know, the standard does say that providers have the capacity to determine whether or not they, you know, they report a student whose attendance has fallen below 70%. So obviously in this circumstance, if a student has been identified as corona, you know, they have coronavirus, that they're positive and that they're supposed to self-quarantine, that is an exceptional circumstance, and obviously there will be documentation in relation to the student's circumstance kept in file, that in the event that, you know, the student's attendance percentage does fall below the required 80 or 70%, the provider is able to then demonstrate that, you know, the reason why the student was not reported, or, you know, that poor unsatisfactory progress or attendance hasn't been communicated, and that's due to the following reasons. So again, as Ben had mentioned, it boils back down to having the appropriate supporting documentation and making sure that there's record keeping in place, and also in terms of providing support to students, just making sure that, you know, that you do engage with them despite of the fact that they may not be on campus and you know, attending classes, that there are mechanisms in place for the provider to continue and maintain contact with the student and provide them that support so that they're able to continue to participate and also hopefully, you know, be able to get through the period of isolation and then come back and be able to continue with their studies.
Thanks, Chris.
Yeah.
And Ben?
Yeah, look, we obviously, ASQA has a sort of similar response to Chris. You know, we understand that providers will need to adopt a flexible approach to students' attendance. Directly affected students may need to exclude themselves, and we understand that. And we understand that there may be a period of isolation that's required as well, and that they may not meet their requirements under the ESOS Act. So, look, from ASQA's perspective, providers should just document all flexible arrangements that are made on a student-by-student basis. Like I said, this is particularly important for arrangements that would usually be considered non-compliant under the ESOS Act, and ASQA will obviously consider those and go through that process. But I guess the main thing is to make sure that the appropriate evidence is collected to outline why a student may not have been able to meet their attendance obligations, and they can be reviewed if required by ASQA, and then that's at least gives ASQA an understanding of what is happening in relation to a particular student. And again, we do encourage where I guess students are identified as being impacted and you are looking at implementing some kind of flexible arrangement, that just contact ASQA, and at least then you've given us a notification that you've got some concerns with particular students, and then we can note that and look at that as we move forward.
Thanks, Ben and Chris. So I guess in summary, the key things picked up there were around documenting individual cases, and in the case that attendance is below 70% because of one of the situations which is really related to this instance, the provider wouldn't necessarily need to be expected to report in that case, as long as they have appropriately documented the circumstances. Would that be correct?
Yes. So, I mean, and it's also I guess, in line with your own policies and processes. So, you know, I mean, I guess the requirement is to having those, having the policies and process to determine a student's attendance and progress. So as long as you're following those processes, you're documenting it. And as Ben had mentioned, in the event that you get asked for that information, that you would be able to provide a robust, I guess, explanation and also documentation to support what has happened and to enable the student to then to progress with their course later down the track.
Thanks, Chris. Okay, we'll move on to the next question in this. The next set of questions are under this theme. So commencements and enrolments, and again, another area where there were a number of specific questions raised. Here, what should colleges do in the case of COVID-19 related to delayed arrivals, deferrals, returning from break, suspension and cancellations? We've had questions in regard to what type of flexible arrangements could be put into place, and I do know we pick up online delivery later in the presentation as well. Can we defer the start date of programs that have yet commenced and make up the time later, and can we pause and recommence? Now, I respect that some of these questions, as I noted up front, may be more pertinent in terms of visa-related components, but here we're sort of, for the individual student, here we're kind of address it on a course level. This time over to you first, Ben.
Sure. Look, Brett, like I said, from ASQA's perspective, it really depends on the circumstances. At the moment, we're obviously looking at where the campus or the students are directly affected by the virus. So it would really be on a case-by-case basis, and we'd have to consider that. And as you said, a lot of this is really particularly around probably has more of an impact on people's visas and those sorts of things rather than necessarily than course delivery. I mean, pausing a program and recommencing it after the campus reopens, I mean, if there was an issue where a campus had to close and we were advised of that, then yeah, that would be suitable in those circumstances. We obviously wouldn't necessarily expect anybody to keep a campus going in the event that the virus is indicated in any circumstance. So look, from our perspective, again, it's about these flexible arrangements and it may not just be on a student, an individual student basis, it may be on a whole institution basis, depending on where we end up going forward. Like I said, this is obviously an evolving situation where things will change probably from week to week at the moment, and we will provide further guidance. And in the circumstances where a campus is required to close for a period of time, ASQA will make individually probably be in contact with that specific campus in relation to what arrangements are suitable and how to manage that process.
Thank you, Ben. And Chris, in terms of TEQSA's perspective on these items?
So in terms of the questions that's up on the screen at the moment, I think TEQSA's perspective is that yes, it would be up to providers to determine, whether or not they would wish to deliver, online or to a mixed mode delivery. But from our perspective, we want providers to consider how are you going to do this. Like obviously an English language course requires, for students to be in a classroom with other students and to be able to discuss and and practice their English language and also converse and engage with their teachers. So in terms of having to wanting to deliver a program online, questions such as does the provider have the capability, the technical capability to deliver those courses online? Have you looked into, in terms of your courses, are they, could you deliver them solely online, or what other modes of delivery could you implement in order to, to supplement perhaps like the face-to-face, component of it. Now, I think from our perspective too, well, not as long as, you need to consider how the students, in the way that you deliver your course, will be able to achieve the learning outcomes of the course. So as I said previously, there are face-to-face components. So if you're going to deliver that online, how are you going to achieve the outcome of that face-to-face interaction from an online component? Would you have a video conferencing? What kind of support would you be providing to students? Would students be able to access their academics or their teachers on a regular basis online through video chats? So those are the kinds of, I think, criteria that you need to be thinking about before we can say, oh yeah, you can go fully online. It's not necessarily as easy as that, as we've previously communicated to the sector. There's also considerations in terms of, are your staff suitably trained and equipped to deliver those the courses or the units online, and also in terms of thinking about academic integrity. Also, how are the assessments going to be, I guess, assessed? Like, if there's a presentation as part of an assessment task, how would then that be translated if you have chosen to take an online delivery component? So I think from TEQSA's perspective, we would like to see that providers have a framework in place to be able to deliver the mixed mode or fully online or via distance education. And we would like to see that students are being supported and also being able to achieve the learning outcomes. So in developing your framework, let's say it's a flexible learning or an online learning framework, of course, TEQSA would want to see that this that process has gone through the appropriate governance channel, so that it's not just something that a provider has thought, okay, this is a good idea and let's roll it out. That we want to see that it's been considered and has been thought through, and that all resources and staffing and mechanisms are in place to be able to support not just the provider but also the students, in particularly achieving those learning outcomes.
And if I could just also add in there, Brett, as well, it's really important that the provider communicates with the student throughout this process, just to really make sure that the student has the ability to access any online process or any flexible arrangement that they look to put in place, because there may be circumstances where a student is unable to actually participate in the flexible arrangement due to resources available to them, etc. So it is really important that any kind of flexible arrangement is the student is directly consulted with to ensure that they're able to participate.
And I think just adding on from that, in the event that it is not available, then as the first, I think, question talks about, deferrals or suspensions. Obviously, that is available, and it's up to the provider to make that determination. And again, if that is the case, then it is expected that that is the appropriate documentations have been put in place, so that if the student is required to then extend their course, then there's supporting documentation to substantiate that.
Thank you, Chris and Ben. I think you've covered off a lot of ground there, and as I mentioned earlier on, perhaps some of that detail will probably cover a number of the questions we have today. I know that just so those key points there, obviously documenting, again, noting how you're going to deliver the course outcomes on an individual student basis. If they're offshore, certainly a range of mixed mode options are all feasible, but treating them on a case-by-case basis and having that documented seem to be the key themes. Moving on, just in the interest of time, on course progression, which was another key item. So it's a little bit of crossover here with what we've had on the prior slides, but again, just in case there's anything that's been missed around the students' course progression requirements, is there any particular actions that the provider needs to be taking at this point? Chris, you first.
I think we've covered most of the, but just in terms of, applying your existing policies and procedures. I know that it's an extraordinary circumstance that we currently find ourselves in, but your usual day-to-day management of similar cases still apply. So if a student fails their obligations for, to meet their course progress, okay, it's because they haven't been able to attend and all that kinds of stuff, but the mechanisms that you have should still be in place. So you still communicate to the student, you still need providers, you still provide the students with the information, and you still provide them the support. So I think definitely from TEQSA's perspective, you implement your existing policies and processes, and document them, and yes, communicate with us if there's anything extraordinary. But I think from our perspective, if you continue to do what you're already doing, it should be it should be in the best interest of not just the students but yourself, but the sector as well.
Thanks, Chris.
Yeah, look, I guess, I'll reiterate what Chris said in the fact that, at the end of the day, we expect providers have some form of policy to deal with this. I mean, in some instances, this is there's similarities obviously to this, and students being on medical leave for other reasons. So we expect that most providers, obviously this is on a can be or maybe on a larger scale, but at least having that documentation within their own policies and procedures to be able to deal with these kind of circumstances. In my experience, most providers are able to, and have a good understanding of their students. So it is a matter of just working through that, going through it on a student by student basis, and I guess making sure that at all times the students are communicated with throughout this process.
Excellent, thanks, Ben. We're moving on now in terms of assessment, and you can see in terms of the theme here, in terms of the approach to standards around assessment if a school is required to close down for a period due to COVID-19. And so I guess we've got this escalating view now that we've moved from potentially dealing with just individual isolated cases to how will this be looked at in terms of if there are particular events that require a close down as well.
Well, look, Brett, I guess from our perspective, I guess it's very important to look at we are responsible for maintaining and monitoring quality, particularly around assessment. Look, if a school is required to close down for a period, we understand that assessments may not be able to take place, and that students may not be able to undertake assessments. However, we would, over time, these assessments could be deferred under a flexible arrangement, and then the students can pick up where they left off once either the school or provider comes out of quarantine, or the students are able to return and be able to undertake those assessments. But I guess the main thing for us is making sure that any student that I guess is deemed competent or is as part of the course provided with any kind of qualification, that they are given quality assessments, and that the provider makes all the necessary arrangements to make sure that those assessments meet the requirements for the student and for the training that they're undertaking.
And just adding on from Ben's comment, so it's if a provider decides that it's a shutdown, then obviously the decision to whether or not continue, when I think it's quite logical that if you shut down, that everything kind of goes down. So therefore there'll be no assessment requirements. However, if you do decide or have the capacity to deliver online or through other means, that the assessments that you're providing to the students from on a face-to-face, I guess, basis is also translated in the online environment. So how, as I said before, providers need to think about how they're going to deliver the units, the assessments from a classroom environment to an online environment, and whether or not and how will the learning outcomes be achieved in that online or virtual environment. So, I guess the thing is, and again, if a provider then chooses to defer any assessments and stuff like that, then that's perfectly fine. But in terms of if providers, as I said, have the capacity to go and deliver in other modes, that you think about how your classroom environment can be replicated in an online or a virtual environment and still achieve the same learning outcomes.
Thanks, Chris. That's really good context from both of you. Okay, just in time again, we'll go on to sort of the next key theme, which was around course delivery. And within course delivery, we will cover off a few more areas around that online blended learning options, delivery methods, alternative delivery methods as well. So just to highlight some of the questions that have come through, I guess potentially some of these are at a provider's own decision in terms of when they activate different modes, but online delivery was one. Chris, you picked it up a couple of times already. It's a very hot topic at the moment, certainly in terms of an alternative method to be able to deliver courses, and there really is, I guess, a lot of questions around how this will be treated from the regulatory perspective. So perhaps we'll go to you first, Ben, because we've heard a little bit on it in terms of the TEQSA approach already.
Yeah, look, and I probably concur with what Chris was saying. It's really about making sure that you maintain that quality. There is options for different courses to be done online, but it is making sure that the student gets what they need out of that. It may, and again, it is making sure that the student can actually participate in those arrangements. I know we're seeing issues with access to certain systems in certain countries from the experience that we've had talking with other providers. So it is really about making sure that the student can actually access if you look to go online, and that quality is maintained. Look, most of us understand that this is a time of where flexibility is going to be required, and look, ASQA's quite openly and put it on our website that where flexible arrangements are made, including online learning, they just really need to be documented how you maintain quality, and that you had the systems in place to actually allow students to participate, and just keeping a record of all of that. Look, online delivery has its own challenges, and however, it can be done in certain circumstances, and where if a provider has a method of doing that which meets assessment requirements and still allows a student to participate in a valid way, we'll look into that, and we can have a chat with a specific provider and have a look at what they've put in place during this time.
And just from Ben's comments, it's so TEQSA is also very we welcome providers contacting us and telling us their plans to deliver, whether it be online or mixed mode. But if you can provide to us a plan as to how you're going to be addressing, as I said before, assessments, the way of delivery, the quality, how does it, the equivalency from, a classroom environment to an online environment, and that, you've considered things like teaching arrangements, the teaching staff, how accessible would they be to students? Yeah, so I think, we welcome providers coming to us with their plans, and, we can go from there.
Thanks, Chris and Ben. And one question which was raised, I guess, separately, I think, in terms of the flexibility. So typically, the regulator would require that if a course was to be delivered in an online or a blended mode, that would have to be registered in advance. But it's my understanding that in terms of the way you're approaching it, that the provider doesn't necessarily have to have completed all that registration process at the moment, but I guess the request is more around the documentation and providing that information. Would that be correct?
Yes. From a TEQSA perspective, yes.
Yes, yeah, and that's correct.
Thank you. I think that is certainly welcomed by providers as they're looking at the options as well. Here, I guess, in terms of that and moving it more into the ELICOS sector, we do have our regulatory requirements around the 20 hours of face-to-face study, and historically the regulatory standards under the ELICOS standards 2018 required the 20 hours face-to-face contact. Guess again, it's just to have confirmation that in circumstances related to this situation, do they still need to do 20 hours face-to-face? Is one particular, 20 hours of study, or can that be altered given the mixed mode? And is that something that, in terms of an alternative, is the 20 hours also being considered, or is that still a sort of a rigid requirement? Perhaps, Chris, you're first.
Yep, I think from a TEQSA perspective, I mean, we talk about being flexible. I guess the question that I would throw to providers is that, as I mentioned before, the face-to-face component of a course has, it has a purpose. Now, how does it meet? Like, what competency are you trying to achieve out of that face-to-face contact? So how would then that be? How would you then assure yourself that the students who, if you're going to deliver online or through a mixed mode, that the students are still gaining that competency without that face-to-face contact? So, and as I said, each provider has a way of dealing with it, and we're welcome to talk with you and to discuss with you whether or not that would, the preferred method that you want to propose is okay, and that would still meet your learning outcomes.
And look, ASQA is quite clear in its communication that we have on our website too, in relation to, I guess, attendance. And we understand that, students during this period of time may not be able to meet these requirements of the 20 hours. And if you go to our website, we've actually made specific comments that we don't intend to pursue regulatory action against providers in this situation, and recommend that all adaptive measures are documented in the relevant student's record. So it is very important that, we're not giving people, I guess, an open book to say no, students don't have to attend their 20 hours. It's more along the lines of, if a student is affected and they're not able to meet this obligation, that the provider has in place documentation and governance around that, so that we know why a student may not have been able to meet these requirements, and that way we can review that and if there is a need for it in the future.
Yep. So yeah, so I will just also echo Ben's comments, and yeah, so I think in terms of that it's about the flexibility, it's about being able to make sure that you have the documented processes in place as well. And yeah, students can't attend, we understand that, but you know, you do need to make sure that there are assurances in place. And how do you assure yourselves that the students, that you are able to provide the student the support and the learnings that they've, you know, that they are there for?
Thank you. Thank you very much. And I know in that regard, I'm assuming it's at the discretion as well. I mean, we've got situations at the moment where you know, students are feeling unwell, but students are also, you know, nervous or concerned about attending class, and approaching students, so their provider around situations where they don't want to attend class. And I guess in that regard, again, it's at the discretion of each individual provider to the student's case. But from what I understand, it's more around ensuring that you've documented the concerns and the way in which you'll monitor that student and have a plan for that student. Would that be fair?
Yes.
Yes.
Thank you. If we may, I'll move us forward. We'll look at another key area around sort of, again, the teacher ratios, and during this period of time, obviously as we're looking at different modes of delivery, as well as managing you know, disrupted timetables here in class as well. You know, hypothetically in this situation, or you know, to the greatest extent you can, the other consideration is around sort of that teaching ratio, the 1:18 within the ASQA standards, and just your views around some flexibility to that standard as well.
Yeah, look, Brett, again, I guess this goes back to the adaptive arrangements during this time. Like I said, we would expect that, you know, obviously if a campus was closed and they've had to move to sort of online delivery, and even teachers' access to being able to do online delivery may be restricted during this period, that, you know, there will be needs for flexibility in this space. Again, like I said, again, it's just making sure that the provider has the ability to do this, and if they, you know, if there is a need to change ratios or do anything of that sort, that it's documented, the reason why. Also, you know, it needs to be considered whether their resources can cope with, you know, any processes they put on, for instance, any kind of online arrangement, etc., that they have the capabilities technically to do this, especially once you start lifting the amount of individuals for potentially accessing an online portal, etc. So it's really down to the specific provider to consider that. Like I said, from ASQA's perspective, we understand that there is going to be a variety of situations, and, you know, one size won't fit all in this during this time. So look, again, for us, it's just making sure that there are governance processes put in place to assist the students through this time, but also making sure that they get still get the quality outcomes that they would have otherwise got had they not been quarantined or isolated or unable to attend their campus.
And just, I think, adding on to that is, you know, your question is how would providers adequately engage with students? You know, obviously if the teaching ratio has gone from 18 to 50, you know, how are you going to provide the support to the students who, you know, in a classroom environment that you could, you know, walk to and discuss, or make arrangements to meet with, to discuss whatever issues or concerns that they may have, you know, in relation to the unit or the assignment. So then how would you then, you know, make sure that you're continuously to engage and that students have access to your staff to be able to, you know, continue on with their work? I think that's just a question that, you know, TEQSA would ask for providers to consider, you know, in administering this, you know, alternative or flexible arrangement in terms of teaching ratio.
Yeah, thank you both. I think you've covered that really well in terms of ways in which it can be documented, but again, the options. We had a few questions which I guess may not be specifically, you may not be able to specifically answer, but again, in terms of some of the constraints and considerations, we've got providers facing particular pressures around cash flow, and certainly that's a consideration, and with the way in which it's predicted to get worse before it gets better. One option was raised around TPS, but I'm not sure if you have any comments that you could make in that regard.
I think I can't really comment on behalf of the TPS, but in terms of, I guess, in the event that a provider decides that, they're closing down due to this, and then, we would expect that, depending on what the situation, if it's a total closure, then obviously the provider default requirements would kick in. But if it's just a temporary closure, then, the expectation is that providers will have something, on an alternative arrangement in place later down the track once they're able to continue their operations, that, students are therefore, given alternative assessments or, classes and all that kinds of stuff, so that in terms of the refund obligations, they wouldn't need to do that. But as I said, if a provider is in a position where they've had to totally close down and, not able to recover, then from a regulatory perspective, there's, the provider default provisions will then need to be adhered to.
Yeah, look, I'll just say from ASQA's perspective, I guess it's not really within our remit to, I guess, talk on behalf of TPS, and I'd suggest that members of this group approach TPS if they have any concerns in the event of a closure. In relation to, again, the second question around the fully online study option for students, I think we've covered that quite extensively. It is really down to the capacity and ability for the particular school to show that they can facilitate that appropriately. Like I said, online delivery does have its challenges, and a provider needs to consider whether what they're putting forward will meet those challenges and be able to provide the student with a quality outcome.
Thank you both. As an aside, I'd just like to note we recognise that this, in terms of the designated account and the fees that particularly private providers holding their designated account has been raised. We, English Australia, have taken up a separate position and contacted both had discussions with the TPS director and the Department of Education around some options that could be explored, and so we'll continue to pursue that as a second matter, separate from what's happening in the regulatory space. Moving on, health and safety, and some questions that we've received around health and safety. There were a range of other questions. We'll move into the questions now, but which were more relevant in terms of state jurisdiction. And again, I know that each state authority now each state health department will have the authority to make decisions around actions taken. But in terms of students' health and safety, is there any specific items that you would like to cover from the regulatory perspective?
I think this is just a good opportunity to remind providers, of their obligations to make sure that they have students' contact details or most recent contact details. And that is regularly the requirement of the Act is to, at least every 6 months is for providers to make sure that they have students or they've updated students' contact details. So I think, given the circumstances or that we're currently in, that it's important that providers are communicating with the students and ensuring that they have the most recent contact details, so that in the event that a shutdown is necessary, that they're able to contact students. And and that also goes with for under 18 students, that that you have the guardian's contact details, the parent contact details as well.
Yeah, thanks, Chris. We've had separate questions raised around overseas student health cover as well. I'd just like to let people know that the questions put in that regard with circulated to the OSHC providers, who are each seeking their own advice at the moment with the World Health Organization's consideration around the global pandemic. We will do a separate update in regard to confirmation around OSHC conditions as well. On the providers, English Australia separately is part of an education sector preparedness committee. That committee is working with each of the state governments and Department of Education around what steps and action providers will need to take. We're hopeful that certainly early next week or sometime next week we'll be able to provide more information on the steps that an institution would need to take in the event of a closure. But at this stage, working with and liaising, so referring to your specific state's Department of Health advice and the protocols, that's certainly the best advice that we can give there. I might move on just in terms of the next set of questions. I know we're getting close to the end of time. Staff and students, and this one's come up a lot, I guess, in terms of what providers are in a confused state of should they be proactively closing campuses and advising students to not come to class, obviously to implement strategies to try and prevent the spread of the virus. Is that in terms of the regulatory approach? What would be the views around steps that providers take if they decide to limit campus access during this period?
Look, I mean, in this circumstance, I'd probably refer the provider to talk to the Department of Health and what the best approach is in relation to whether campuses should be open, closed, etc. It's not really within ASQA's sort of remit to determine that, nor do we have the expertise in that space. Look, like I said, I guess earlier, is if a provider does have to shut down as a result of the virus, I advise them to contact ASQA and just keep us informed of what is going on, just so that we're able to at least note that and that there's documentation around that when we, in the instance that the campus opens up at a later date.
Yep. So TEQSA echoes ASQA's approach to things. So if you are in a situation where a shutdown is required, please let TEQSA know, and we'll work with you to make sure that things are in place and that I guess everybody's safety is the primary concern. I just thought, just reading the questions, just some general, I guess, observations. Obviously, this is a time, quite a difficult and unique time that we have, but it's also an opportunity for providers to, I guess, review their existing policies and processes. If you have a business continuity plan, how are you going to activate your critical incident management plan? What's your risk management, I guess, processes and stuff like that. So, hopefully we won't have to come across a similar situation in the future, but in the event that we do, at least, hopefully we'll be better prepared in future. So I think it's just, I would encourage providers to look into their existing processes and policies and to perhaps consider, if a similar event occurs in future, how would you deal with that?
Yeah, thank you, both Ben and Chris. I think, some really key advice there in terms of if you are making a decision, be it due to the identification of a case and the steps that need to be taken if a case is identified on campus, and obviously the State Health Department will have particular protocols that need to be undertaken around closures and sanitation and that period. But also if you do have concerns around closing for other welfare arrangements, that what's most critical is to contact the regulatory body to note the decisions being made and just to have that documented seems to be a good way. So the appropriate process. And just moving on. We've throughout the session had a few questions raised, which we've tried to cover just in some of the comments. I think what we'll do, with the interest of time, and we've just clicked on to the end of the webinar proposed period, I would like to say we've I think covered most of the questions or themes of questions that were sent in advance. For those that did put in questions that were related to conditions around overseas student health cover or visa related questions, we'll follow up with you individually. If there's something that's not being covered, please don't hesitate to still use the process that was provided in terms of registering questions, and we'll come back to you quickly. Ben and Chris, I assume you guys are open to answering any further questions post the webinar?
Yep.
Yep. And look, and like I said earlier, I would just encourage everyone to keep an eye on our websites, and we'll be providing regular updates there anyway as well.
Yep. The same. And I think I provided the CRICOS inbox email address, so you're also welcome to contact the CRICOS team if you have any questions.
Thank you. Well, thank you to both Ben and Chris and your respective agencies. I think it's reassuring to have that ability for colleges across the ELICOS sector, English Australian members, to hear firsthand around the approaches that are being implemented by the agencies, and also that willingness to take a collaborative approach where feasible. And you've really highlighted some of the key components around documenting and record keeping. So thank you and well done.
Thank you, Brett. Thank you to all the members.
Thank you, Brett, and thank you everybody else.
Right. And bye for now, and we look forward to distributing further information as it comes to hand.